I think we're live.
Assalamu alaikum and welcome to our very first episode of Chit Chat and Chai, Let's Talk Careers. This, as the name suggests, is a platform used to discuss various professions, and we will be various professionals to share and enlighten us about the invaluable knowledge and experience in various industries to help our young people in making informed decisions about careers and the industries that they would like to go into. So without further ado, we would like to introduce our very first guest speaker today, which is Kiran Rahim. And Kaim, would you like to introduce her?
Obviously, it's really good to see you guys. Assalamu alaikum wa rahmatullahi wa barakatuh. It's good to be back on Face Inspire once again. It's been a long time since I've seen you guys. And it's good to be back. Our first guest for today's show is Kiran. Kiran is a doctor as part of the NHS and also a mom to two boys who are currently working in London. She's also on Instagram, as you may have seen her, as the Munching Medic, where she talks about all things related to womanhood, motherhood, and life as a working mom. She is extremely passionate and advocate for child health promotion in BAME communities, and supporting women to pursue higher education and leadership roles, and uses her platform to talk about key issues such relating to women and children. Hopefully, we hope to touch on that a little bit more today. Arifa, would you like to introduce our second guest for today's show?
So we've got Sabu here, who is a pharmacist. She studied at King's College London, and had training at Royal Brompton Hospital, and now is working at King's College Hospital as a pharmacist, as the hospital pharmacist, and is currently undertaking a postgraduate diploma with UCL. So thank you very much both for joining us today.
No problem, glad to be here. Yeah.
And just to sort of break up the conversation there, you know, a lot of people have this, when they were young, they've always got this mindset that when I was 10 years old, I wanted to be a doctor, I wanted to save lives, or I wanted to be an astronaut, and you know, all of those kind of things. So I want to ask you guys, as you were growing up, did you always want to be a pharmacist and a doctor, or was it something that you changed your mind a lot on? How did you sort of end up where you've ended up?
So assalamu alaikum everyone, my name's Kiran, and thank you for your warm and kind introduction. I think for most people, I can't speak for the majority, but generally most of my friends and most of my colleagues, most of us have wanted to be doctors for a very long time, and that certainly is the case for me. So one of the biggest drives I had to do medicine is that I spent a lot of time as a child in and out of hospital. I was born with a cleft lip, which means that I had a facial disfigurement, which meant I was in and out of hospital for corrective surgeries. And so the earliest exposure I had to professionalism was to doctors. So yeah, and you know, obviously I'm brown, there's no denying it, that every Asian parent in those days would push towards certain careers, but
even in these days I would say so.
Even, well, less hopefully now. So I would say, you know, a part of it was a drive from my parents, but actually I came into my own. And, you know, through school, I sailed through school. Alhamdulillah, I always had good grades. So the grades was never an issue. It was whether I wanted to do it or not. And there was only a very brief moment in my A-level times where I thought I might do finance and economics, just because I was really very good at maths. I really enjoyed physics, and I was also tempted by the money in the markets. But you know, I think my passion for helping people, and I'm quite empathic by nature, that took over. So I ended up doing medicine instead.
Yeah. And what about yourself, Sabuhi?
I think I always knew I wanted to be in the healthcare sector. I found psychology really interesting. I found interaction with people really good. I wanted something that will give me, you know, feel happy that I'm responding to people and giving them a better quality of life. What profession that was, I wasn't too sure. I wanted a good work-life balance, something with a stable income, always been passionate about the NHS, and pharmacy kind of gave me that direction. And I think people always think pharmacy is literally just community, hospital, those are your two routes. You take one or the other. There are so many other things you can do. There's prison pharmacy, there's care homes, there's the industry. There's so many different routes you can take. And I felt like that gave me the opportunity to undergo that. So I started work, I went to university at King's College London. I wasn't originally going to go there. I was originally going to go to Durham, and on the day of A-levels, I studied hard, but I did find A-levels hard. So on the day of university results, I had to retake a year, did my A-levels again. Nothing wrong with it. Gap years can actually be a really amazing thing for you. And at the time, it felt awful. But after that year, got into where I wanted to go and really enjoyed my 4 years at university. Then from there, did a pre-registration year. You finish your master's degree, do a 1-year training called the pre-registration year. Did that at Royal Brompton Hospital. And at that point, I knew I definitely wanted to stay in the hospital sector. You have some people that are like, nope, hospital's not for me, I'm going back into community. Some people who love their community jobs. It all depends on your personality and what you prefer. So for me, I really enjoy the patient interaction and the MDT, which is the multidisciplinary team, that you get to liaise with lots of different healthcare professionals and you truly feel part of something, which is fantastic.
Sounds great. Seems like you've had a bit of a journey, which is great. I was going to actually touch upon the A-level side of stuff, given the current climate with the A-level results this year and the coronavirus and all of that. So we will touch upon that again, maybe later in the show. So yeah, you kind of, did you always feel like you wanted to do pharmacy from the beginning, or was it something that kind of developed over time and your interest kind of developed in this area?
For me, I knew healthcare was the area I wanted to be in because I enjoyed the sciences. I enjoyed the concept of improving other people's lives. I enjoyed the concept of being part of something like the NHS. So when I was exploring my options, what's the next thing you do? Work experience. So started working in a community pharmacy. I found it interesting. I was absolutely amazed that one person can know literally any medication, what it's for, what the doses are, what the side effects are, what the interactions are. And if they don't know, they know where to look. And I just found that amazing. And that was kind of where I started thinking pharmacy could be good. Thought there'd be a decent work-life balance. That was also really important to me. I wanted to have a good home life, a good structure. Being in hospitals made me realize that's not necessarily what you get out of pharmacy. There are still the on-calls and you still have long hours and shifts, and it's the same for community. There are long hours, but if you enjoy what you do, it doesn't feel like a chore anymore. And if you've got a supportive family around you, that's great. So I'm kind of walked into pharmacy and I found a passion there, so I'm really happy about that.
Okay. And what about you, Kieran? Did you, like, I know you've mentioned about kind of being in and out of hospital, having first-hand experience. That's kind of I suppose inspired you to some extent to kind of go down this route. But was there any time during your studies, would you say, that you found that you kind of thought, you know what, it's too difficult, or it's not for me, or I want to kind of give up or do something else instead? Or was this kind of the route that you wanted to take and you were absolutely sure? Because obviously medicine is a long route. It takes at least 5 years to actually complete just the initial degree, really. So what was your kind of expectation, and did university kind of give you that, or did you have any?
I mean, to be honest with you, I think, you know, people always talk about medicine being a really long degree and, you know, that all of this stuff, but actually medicine is lifelong learning. I have been studying now, I mean, I'm 30, I'm in my mid 30s now, and I've been studying pretty much 20 plus years of my life. So yes, I think the one thing you do need to know about medicine is that it is, you are engaging in a lifelong learning and you have to actively do it. So it's not like other professions or careers where you go to uni, you get your degree and that's it. Where you regularly have to do postgraduate exams, depending on what specialty you want to do. You regularly have to update your CV, you regularly have to attend courses and stuff. So there is an element of constantly learning, and I really enjoy that. And I think it's one of the things that drew me to medicine, because irrespective of what career you choose, I'm a big believer in sort of self-growth and self-improvement. And so, and you know, even our dean talks about like knowledge and seeking all aspects of knowledge. And I love that about medicine, because there's elements of psychology, there's elements of ethics, there's elements of maths in there, you know, when we're doing our, like, for example, complex drug calculations on ITU or whatever. But I knew I wanted to do medicine, and university, you know, I really enjoyed uni, and I made some really wonderful friends there. I had the opportunity to be exposed to cultures I wouldn't have necessarily known about. And I think that's what's more important than the knowledge I acquired. And that sounds strange, because how I learned to be a doctor isn't necessarily in med school. I learned the basics of like anatomy and physiology and pharmacology and all of that kind of stuff, but application comes with practice. And it was only when I started working that I learned how to be a doctor. And I think medical students these days get really stressed, because obviously for them this is the most crucial part of their careers. And you know, if you look at a person over a 70-year journey, uni is just a small part of it. It's 5 years out of how long? 70, 80, 90 years. So I always say to my medical students, you're never going to get your time at university back. And instead of building your CVs, build yourself, because that is more important. And it's more important to cultivate yourself and find out who you are and what your interests are and what your strengths are, and work with them, than to think about flogging those A's and, you know, being in the top cohort or being in the top 10% or getting publications, because all of that will come if you are, you know, comfortable in who you are and you know your own strengths. And I will also say this to students that have, you know, I mentor for a into university campaign, which talks about getting students from poorer backgrounds into higher education, and particularly in fields like medicine, where historically it's been the white upper middle class. And you know, a lot of those students unfortunately have been shafted this year and didn't get their grades, and that's fine. And I say to all of my students, you know what, 1 year is minuscule in the grand scheme of things. So if you have to retake this year, if you have to go back and, I don't know, get a job for a year, get some work experience, sit at home, do something with that year and come back stronger, because I promise you, no one's going to ask you in 10 years. I mean, I've been a doctor now, what, for 10 years? Nobody asks me what I got for my GCSEs, what I got for my A levels, what I did in my year out, how come I'm not a consultant yet? Because you know what? Each person has their own journey, and it is absolutely okay to have a journey that doesn't fit in with the norm and doesn't fit in with the cohort or whatever else is going on. So for me, yes, university was fantastic. I really enjoyed it. And then I qualified in 2011 and I did my F1 and F2. So for those of you that are watching, that's your foundation years, and that is essentially where you do essential rotations in medicine and surgery before you start to pick a specialty. And then subsequently, I really liked working with children, so I decided to go into pediatric medicine, and I'm been a pediatric doctor now since 2013, I want to say. And I've, you know, alhamdulillah, I've had 2 kids. I work full time. My kids are in school. I have a great work-life balance most of the time. My job is hard. I'm not going to deny that. And I think anyone that wants to pursue a career in medicine needs to know how hard it is. It is often demanding. You do often have to make choices between family and work and stuff. But I think since when I started and now, I think the times have changed significantly, and there are lots of fantastic things doctors are doing now. So, you know, I know loads of people that only work part-time and they're yoga teachers in the other part-time, or they have like a music business, or they are dancing and teaching dance in the other time that they're not doctors. And you know what, that just goes to show that you can pave your own journey. And you know, when I was at med school, I was constantly told to be a GP, because there was no way I could be a hospital doctor and have a life and be married and have kids. And I thought to myself, you know what? No, I will do whatever it is I fancy, where my passion lies, because I don't want to go down a path where 20 years from now I'm unhappy and dissatisfied with what's going on. And you know, I did it, like, alhamdulillah. And I'm not, and you know, in my field now, I can probably count the number of Muslim hijabis that are pediatric doctors, that are in senior positions or in senior leadership roles. And I really hope, because I didn't have anyone like me when I was at med school. They were all white females or white males. And I really hope that in the next 10 years, someone can say, well, actually, no, there are female Muslims, you know, doing great things in the field of medicine and surgery and pharmacy and whatever. And I don't need to choose between having a home life and having a career. I can have it all. And you can't have it all the time. And that's fine. There's a time and place for everything. You know, you can't, you know, have a baby and work at the same time. That's not going to happen, and that's okay. You just need to find your feet. So don't be disheartened if the journey you're taking is slightly an aberrant path to where you need to go. I'm a big believer we are all where we need to be at exactly the right moment in time, and that's what our dean teaches us as well, that whatever embraces us can only be good for us.
Brilliant.
And yeah, Kieran, you mentioned over there how you you mentioned your journey obviously from uni to F1, F2, and then going into P, then you just stuck to that. I want to switch it over to Subuhi, where you mentioned, I think earlier on, that you were a hospital pharmacist. Is that correct?
Yeah.
Yes, I want to ask you, firstly, okay, just clarify for the people what hospital and community pharmacy is, and secondly, why did you pick hospital over community when community tends to be what the vast majority of them people get into, really?
I think hospital is overall a lot more competitive. It's quite hard to get into. I think community pharmacy is easier to get into. It doesn't mean the job itself isn't hard. The hours in community are a little bit more tedious. You can end up staying till 7, 8 o'clock sometimes. Whereas hospital, I think the hours are a little bit more consistent and regular, just a little different as you go along. The reason why, actually, when I first started university, I thought I wanted to do community pharmacy because that's what I was mainly exposed to. Then as you go along in your summers, you get the opportunity of summer placements. They tend to open around January time for that following summer. And I just filled up my 3rd year summer with summer placements. And I just thought, let me do one with Boots, let me do one with Royal Brompton, and I did one with St Thomas's Hospital. And essentially you're shadowing pharmacists and you're doing an audit where you look at something in the hospital and you check to see against their guidance to see whether it's following how it goes. And I really enjoyed the hospital experience. And I thought, wow, this is something I can really see myself doing. Role models, I'd say in pharmacy, there are a lot more Muslim hijabis. I think that's definitely, there's a lot more Muslims. I'm sure you know you're doing pharmacy as well. You don't really have that issue. However, in hospital, you do see the number reduce significantly. Especially the higher up you go, there's less. And alhamdulillah, I've been very blessed to have 2 very supportive families. My family, my husband's family, have always been, you go do what you want to do. We will be there to back you. And I've been really lucky in that sense. So I went for the London hospitals. Alhamdulillah, got in, and now I'm doing a structured training program, which incorporates the diploma by UCL, which is like a postgrad diploma where you further your knowledge in clinical pharmacy. And that essentially is an on-the-go job. You do work-based assessments and your job at the same time. Essentially, the hospital job is you're on the ward. Mine consists of 2 different areas. I'm clinically based, so I'll be on the wards for a certain period of time in the day where I will be looking through a set of patients on a ward. You'll be split into different rotations. So you have surgery, you have acute medicine, where there are people who've just come from A&E. You have post-acute for those who are going to be a bit longer stay. And you have hematology, which is cancer patients. You have liver, because King's College Hospital is a major liver hospital. And you do your rotations, and essentially on the ward, you look at a patient, you look at what medication they're taking firstly, because that's the pharmacist's responsibility. Ensure their full medication history is documented, ensure that it is what the patient's taking, so whether you speak to them, their next of kin, their GP records, of course, confidentiality is important, making sure you get patients' permission to do that. Check the medication, find out, make sure that they're not on anything important that needs to be prescribed in hospital, make sure that nothing's being missed. That's the first thing. Then they'll be having bloods regularly every day. We check their bloods, check to make sure their electrolytes, so their sodium, potassium, those kind of things are all within range. We're checking their kidney function, their liver function. If I see their kidney functions going out of range, that would be an alarm bell for me, because lots of medications pass through the kidney and are metabolized through the kidney. So I would raise that and I would say, this patient's on this antibiotic, for example, they've got a kidney function of this, we need to reduce the antibiotic to this dose in order for them to not get any toxicity. And that's the kind of liaising you have with nurses and doctors on the ward. You also talk to speech therapists and physio if they've got any swallowing difficulties, giving them recommendations of liquid formations instead. And I just really enjoy that interaction, or talking to the patients, or seeing them go from being non-compliant to compliant just on a small thing, finding out whether it's intentional or unintentional, why are they struggling? Okay, and that's essentially what you do in hospital. In community, it's kind of seen as tertiary care, so they will have repeat prescriptions. They'll provide the medication they're taking at home. They can also have I think medicines compliance conversations to find out how they're getting on with their medicines. And essentially it's a service that you can access a healthcare professional outside of a GP surgery or a hospital, and they can flag you in the right direction if necessary. So I think pharmacy is definitely a growing profession. I find what was happening 5 years ago and what's happening now, there's a lot more emphasis on what pharmacy is doing. And I think COVID really has shown the importance of pharmacy and their importance in the MDT. So hopefully going forward, it will continue to be that way.
You mentioned that you work in a hospital, of course, and I think Kieran also works in a hospital. So I think it might be a good time to touch upon this sort of common misconception or an idea that people have, that obviously is that sort of healthcare hierarchy, or people have assumed that doctors are right at the top, and then maybe you've got nurses and then porters, pharmacists, the radiologists, all the other stuff. So in both of your sort of work experiences, have you come across this, or is it just like a myth that people are sort of almost just established?
I mean, I think it would be really naive to think that there isn't hierarchy. There definitely is hierarchy. There definitely is a difference between management and clinical staff. And in clinical staff, I include everyone, including doctors, nurses, pharmacists, speech language therapists, dietitians. There is a hierarchy there. And this is something that I advocate for quite a lot, because actually the hierarchy in hospital medicine is essentially pale, male, and stale. What that means is like white male people over in their 50s or 60s, and that is a well-documented phenomenon. There are lots of articles talking about the paucity of Black and ethnic minorities in leadership positions in the NHS, and I'm not talking about just in medicine or as doctors. I'm talking about the NHS as a whole. And this year in particular, I haven't really been in a clinical role. I've been in a medical education role. And one of the things that I teach about and I get people to acknowledge is the biases that we all carry with us, and how that affects our clinical practice, our judgment. And it's those little things like, do we, brush aside our female colleagues' opinion more than our male colleagues? Or do we think the white person in the room has more substance than the ethnic person? Do you know what I'm saying? It's about recognizing that. So to say that these issues aren't there would be naive. I think the platform is changing. I think Muslims and ethnic minorities, so people from all backgrounds, are challenging leadership within the NHS, but I think we have a long way to go, because there's very subtle racism and there's very subtle xenophobia within the NHS which exists, and I think that's what people need to be, because everyone assumes racism to be the white neo-Nazi. That's not the case. It's about how many people from the Black community that are getting your leadership roles. It's about giving the people that are best qualified for the job without having those racial biases. So I think there is definitely this underplay that goes on, but that doesn't stop people from achieving things. Just to give you an example, I don't know if you know about Mr. Shafi. He's a surgeon that works in the Royal London, and he is doing amazing stuff across the NHS, and he is a very prominent male Asian Muslim bloke, and it's fantastic to see that. And the GP of the year 2020 was a female hijabi Muslim, which is excellent. And this is what we want. We want people from all backgrounds and all ethnicities to be at the forefront in healthcare, so that when Mohammed, who's 5 years old, or Aisha, or I don't know, Chrissy, who's black, you know, she can look up to these role models and think, you know what, that could be me. Because certainly when I was at med school, there was no one like that. It was all very much, as I said, pale, male, and stale. And, you know, we were actively discouraged to pursue medical roles or hospital medicine, because who's going to cook roti for your husband, or who's going to look after your kids, or don't you want a life? And you know what, like, we need to stop teaching our youth that they can't achieve what they want within reason, because they can. It's about finding a way that works for you and your family.
I would completely concur with Kieran. The only thing I would mention is that it's not literally just a racial thing or a professional thing. It's also gender-based as well.
Absolutely.
So the difference is before it would be denied. You'd be like, no, it's just coincidence. Or no, there were just more people applying for those roles. Now there's concrete evidence to say, no, there is a hierarchy. No, white males are prominent at the top. There is racism but the difference is that now we're aware of it. Managers are being taught to be aware of it. So for example, when I was in one of my rotations, we had a meeting and the manager was a white male, and he went, I know I'm in a privileged position, I understand that, but I want to represent you guys as well, and I want you to know that I have your back, and if you have any concerns, talk to me. So it's these people who are in these positions, if they're aware of it too and understand the privilege they have, they can also try and help make those changes. And we can't be part of that if we're not applying for it. So go for it. Do what you want to do. Pursue what you want to pursue. And keep trying. And we spoke a little bit earlier about A-level students who got their grades this year, and you will not be resitting if you sit an exam this year. It'll be the first time you're sitting at that exam. And if it's being seen as a resit, it doesn't matter.
So what? Honestly.
It's your future. It's 1 year. If you're sitting one exam or 3 exams, it doesn't matter. You will learn so much this year about yourself regardless. And I'm telling you, Allah has a plan for everyone. And we may not be able to see it now, but we'll be in a year's time, we will. For example, in that year, all my friends went to university. I thought, oh gosh, it's just me. But I sat that year, I met my husband. I would not have met him if it wasn't for that gap year. So many things played in that way. I wouldn't have gone to university in London. It's just a series of events, and you will never know until you just pursue what you want.
Sure. Following from the biases, racial biases and the hierarchy, when you first became a professional, so right after graduating from university, and you kind of just stepped into this big world of medicine and pharmacy and hospital and the hospital setting, how did you you probably, like you said, it's very heavily male dominated, male parent style. How did you kind of manage to overcome like imposter syndrome, which is quite common for BAME, young people from BAME communities, if you like? Did you ever feel like you weren't enough, you weren't good enough, or considering the setting itself, it's so different to perhaps a setting that you may be used to? Did you ever feel like, did you ever feel like you probably didn't fit in, or you had to work extra hard to kind of fit in, or kind of feel like, you've got...
You know what, there's this idea that we have to fit in, and who says we have to fit in? Like, I have grown up my entire life looking different, right? And I am really comfortable in my own skin. And when I was growing up, people said to my parents, you're never going to get married, you should find her a husband from back home, she's never going to have kids and stuff. And you know what, all those people are probably sat there feeling very sorry for themselves. And yes, when I qualified as a doctor, I worked in Chelmsford. For those of you that don't know, it's a very white, very upper middle class community, and I was probably the only Muslim hijabi in that community. And there were racial comments. I was asked to leave consultations, and the thing is, confidence comes with time. And so as a first year doctor, I definitely wasn't empowered to call it out, because you're learning. It was a baptism of fire. I had no idea what being a doctor was about. It was very, very terrifying. It was incredibly long hours, and it was just about survival. And then I became a second year doctor, and then I became an SHO, and then I became a specialist. So I am now a specialist, which is a hard term for me to use, because I don't consider myself a specialist, but actually, for all purposes, that is what I am. I specialize in child and adolescent health. And so if someone wants a specialist opinion about pediatric medicine, they would refer to someone like me. And, that imposter syndrome doesn't go. And I have been a doctor for 10 years, and I will still second guess myself. And you know what? I think that's important. I think there's an important part of acknowledging that you don't know everything, that you are not the person that needs to know everything, and knowing where to look for it. So even now, I would say I don't know everything, and I'm okay with that, but I know where to ask for help and how to get that information. So yes, imposter syndrome is real, and it is definitely something that is seen in the Black and ethnic minority, but I don't think it's anything to be ashamed of. I think it shows humility. I would much rather have someone that second guesses themselves than someone that thinks they know everything, because that's when mistakes happen, and someone that has an open mind to be able to learn from different angles. And I talk about this on my Instagram platform a lot. Like, doctors are really revered in certain backgrounds and stuff, and I always say, a good doctor is nothing without the excellent team that we work in. So I am who I am by virtue of the nurses that have taught me, the pharmacists that have picked up my mistakes, the dietitians that have taken time to share their expertise with me. We are an amalgamation of knowledge that has kindly been shared by the people around us. So yes, we will always have imposter syndrome, because there will always be someone who knows something more. And even though I consider myself a child specialist, I won't have the knowledge that someone else that has been practicing in my field for 30 years will have. And there's nothing wrong with that. Humility is so important in all aspects of life. And I think people, especially the current generation that are incoming, and I see this in my medical students a lot, there is a grandeur of I know everything, and I'm the best person because I'm going to be a doctor or whatever, and you need to lose that chip off your shoulder, because we all work in an MDT, and just because I'm a doctor doesn't mean I'm better than the nurse, or that we're better than the pharmacist, or we're better than the person that cleans. You have to have respect for all people. We are all doing the job that we are meant to be doing. And if the cleaner decided not to clean, there is no way I could admit a patient, discharge a patient, have like a side room. Everything fits into a system, and you have to have respect for that system and for other people. So we all have imposter syndrome, and I think it's a wonderful thing that we do.
I think I only completed my pre-registration year last year, so this is my first year of working as a qualified pharmacist. And I genuinely thought, at the end of my registration year, I'm going to know everything about all medicines, and that's it. And I think the minute you start thinking you know everything is when you're going to go wrong. Having that at the back of your head, that there's always going to be things to learn, and especially in healthcare, things are constantly changing. Evidence is constantly coming through. You're constantly learning. So if you are interested in constantly having that, being up to date, and updating your knowledge and being part of that, and using current evidence, using clinical trials towards patients to improve their health, is definitely a good setting to go towards. I completely agree that there is the imposter syndrome, and you can feel that way sometimes. You think, oh, it just must be a coincidence I am where I am. It must be, I just got lucky. I keep thinking that to myself sometimes. But no, it's through hard work, determination, okay, and just be yourself. There's no denying that there's that inner desire to fit in. I think we all have it at different stages of life. But if I need to go pray my Zohar, I need to go pray my Zohar. I will go to the prayer room. I'm not afraid to say I'm going to go. And as long as you let your managers know and you're not taking the mick, you just take 10, 20 minutes out of your day to go do that. It's fine. People respect you for it, rather than trying to hide around and, hide your religion, hide your faith. It's better just to be open and honest, and let your personality shine through. Let the values, this is such a good opportunity to show what a Muslim actually is, by being yourself, showing the values of a Muslim, treating everyone equally, saying thank you to the cleaners who are cleaning, or the porter that's taking the medication. valuing on call when a nurse calls you about a concern, like just valuing everyone. Completely agree, it's so important. And if they see a face of someone who's wearing hijab or is a Muslim, male or female, it makes a big difference.
Absolutely.
Yeah, I think you touched on a really nice point about you working in that sector as being like a form of da'wah for you. I think a question that just came up to my mind is, how does a Muslim sort of deal with situations where you have to sort of talk about these things? I remember one of my teachers, he was telling me that as a Muslim working in a non-Muslim dominated area, sometimes your colleagues might say, okay, let's go to the pub for a drink, or these kind of situations. So how do you sort of manage that? Do you just bluntly say no? Do you try and go for an OJ over there? How do you sort of try and manage it?
Yeah. I mean, you know, there's nothing wrong. I think you have to you have to have a bit of common sense with these things. I mean, if you're happy to go to a pub as a Muslim, that's completely your decision and that's fine. I'm not going to judge you. I often just say, I'm really sorry, it's not an environment I'm comfortable in. And that is the end of that discussion. But actually, I have learned now in my 10 years of practice that I will be the person that organizes the social. So when I first now start a job, the first thing I say is, it would be really nice if we all went out for a meal and I will arrange it, so that I am not in that position. And if they then want to go out for a drink afterwards, that's fine. And you know, I think it's really important to have these discussions. Whenever I start a new job, and we rotate every 6 months, which is ridiculous. So every 6 months I change hospitals, I have a new team of nursing, and so every 6 months I'm having the same conversations. I'm really sorry I don't go to pubs. I find the environment uncomfortable. I need 10-15 minutes in my day to do my prayers. Is it okay for you to cover me? You know, these are conversations, and there's no shame about it. Okay, people take 15-20 minute breaks to go have a smoke. There's no reason why you can't do your prayers. Pregnant women don't drink. People with healthcare conditions don't drink. There's no reason why you have to be shy about not drinking. There are people that don't drink for healthcare reasons, people that do yoga. It's about embracing one another's differences. And I have lots of friends who are not Muslim. I have, you know, gay friends, I have trans friends, and it's okay. You have to be accepting of other people and their decisions to lead their life how they want. You as a Muslim can only do right by you. So you carry your faith, you carry it with pride, and you say, these are the boundaries in which I'm happy to work in, and that is it. And it gets easier the older you get. You know, I am now a mom of 2 and I'm in my mid-30s. I'm not going to have someone speak to me like I'm a 5-year-old. And you know, the strength I have now is not the same strength I had 10 years ago. So where Sabuhi is like a first-year pharmacist, and I think back to being a first-year doctor, there are certain things I would have let slide that no one is going to get away with now in a million years. So if someone said to me, you're not going for a prayer break, I'll be like, you are not the boss of me. I'm able to manage my own time. And it's about having that conversation. And it's okay to not fit in. It's okay to be different. It's okay to, you know, do something that is not the norm.
I think one thing I struggled with was during Ramadan. People saying, oh, how are you going to be able to concentrate at work if you're fasting? How are you going to be able to do that? And I'd say me psychologically made a bit more of a conscious effort to be extra hyper and extra chirpy and extra talking to people and not looking dull and tired or anything like that, just to represent Islam and say, I'm fine. I will get my job done and I can do both. And it's not a problem.
Whereas me, Sabuhi, that conversation has now changed. So now I will say, so Ramadan is coming up, guys. I will need a little bit more support in like making sure my prayers are happening. So I won't be as social as much. So I'm just giving you a heads up. Do you know what I'm saying? So the dynamics have changed, and that will change for you as well. Because you know what, in the beginning, the questions, oh my God, like you don't eat all day, and does that include water, and all of these questions are just now irrelevant. So you have to own your own identity. So now when Ramadan comes up, I send out an email or a WhatsApp message to say, hey guys, Ramadan is starting in 5 days. These are the things that I'll be doing, and if you want to know more, come and have a conversation. But otherwise, I would really appreciate it if you could hold my bleep while I go pray. Or do you know what I'm saying? That conversation will change as you find your feet.
Completely agree with you. I completely agree.
I think we've spoken a little bit about balancing sort of religion and career there. We've got a question from one of our viewers, possibly for both of you, is how does one balance career, home and social life, especially being in the healthcare sector where you're on call, you've got nights, you're working 9 to 9, 7 to 8, whatever the timings are, you're exhausted by the time you finish working. So how do you give work its due right, your family's due right, and your friends also their due right?
I can tell you about my on-call rota at the moment. I actually had an on-call last night. So I'm on call every 12 days. So I work 9 to 5:30. That's fairly regular. As it's in London, it's quite easy to get into Central if I need to meet anyone. Most of my friends are in East. Again, the tube systems are not a problem and tend to be okay. I think it really does depend. Like let me start with my rota. So I'm working 9 to 5:30 every day. Then every 12 days, I work 9 a.m. to 9 p.m. Then the next day during the day, I'm off. And that evening, I start work at 5:30 and I finish at 9 a.m. the next day. Then I'm off during the day that day and I'm back to work the next day. Now, at first, I was thinking, oh my goodness, that's crazy. How am I going to be able to go to work the next day if I've done a night shift, etc.? But actually, having that day off is a chance to meet maybe friends that have got a day off that day as well. It's a chance to catch up with, it's like life admin. That's what I call it. That's what my family call it. You need to go to the post office, need to return an ASOS item, whatever it may be. You know, I can do that on my day off. So you find the benefits out of your rota. With family, you tend to know your rota quite well in advance. So if you know someone's birthday is coming up, try and swap it in advance. Or if you have the rota and someone wants to do a party or something, tell them I'm not free on these dates. You're not going to be able to attend every event, but that's part of working in the healthcare environment. You have to find that balance somehow. As long as your family are aware, your friends are aware of your setting, of your life, of your lifestyle, they will be understanding. And it's not forever. I think the first few years are always most heavy on, and it does. I'm sure Corinne will be able to tell me better what it's like later on. But you kind of get used to it, and as long as you've got supportive people around you and good people, good friends around you, it's not really an issue. You make it work. You might have to plan a social gathering like 2 months in advance, but it happens, and it's good.
And I completely agree. So I have a very different working pattern. So I have a 8-week rota, of which 1 week is nights, and then I work every other weekend, which is usually 8 till 9:30 or 8 till 10. I'm usually on call a few days a week. So that means I'm working until 9 p.m, maybe 1 or 2 days a week. And I enjoy it. And people are like, oh my God, that's insane. I mean, yes, I work a 60 to 80 hour week, but if any of you follow me on social media, you will know that I also run a social media account. I have 2 boys. I go out a lot. I eat out a lot. That's one of my passions. I write about food.
So you must have enjoyed the Eat Out to Help Out scheme this month then.
You know what? I actually didn't. So I didn't take that's for COVID reasons, and I don't necessarily agree with this scheme. I think the money could have been spent on, for example, providing breakfast for children in primary school, which we've stopped doing, or for providing for the poor. I think people that have benefited from that scheme don't really need it, if I'm completely honest, but that's a completely separate issue. So yeah, I mean, I work a 60 to 80 hour week. I'm on call quite a lot, and I do the same things that Sabuhi has suggested. I get a 6-month rota. I look at my rota and say, okay, I finished nights on a Monday morning. So I do nights Friday, Saturday, Sunday. I finish on a Monday morning. Let me see which one of my friends is free for breakfast. So I will finish night. I will go straight for breakfast. If it's not breakfast, it will be lunch. And then I look at my 9 to 5. I mean, I hardly have any 9 to 5 days. They're usually 8 till 6. So I look at those days and I see, okay, which days can I have a date night with my husband? Which days can I pencil to see my sister-in-law? Which days can I go out with my friends? These are the weekends I'm free, guys. Can we meet on this weekend? If not, these are the days I can do in the next few months. And stuff is planned in advance. So yeah, as you get older, that spontaneity decreases, and that's fine, because as you go through uni, you go through training, your friend circle also decreases. You start filtering out the friends that matter and the friends that you've naturally grown distant from, and that's fine. That's a natural process of life.
I'm experiencing that at the moment.
Yeah, and that's okay. You're not going to have the same 100 friends that you had at uni. And you know, I was one of the very first people in my friend circle to get married, and then to have kids. And so when people are not in that same life phase as you, it's very hard to relate and have, like, you know, someone isn't going to understand that I can't now come out because my child has a fever of 40, that I need to be at home, unless you're a parent. And that's okay. So you get your rota, you figure it out, you plan things to look forward to. So the days and weeks I know I'm busiest, I always have something for self-care. So it may be like a massage, it may be like I'm going to get my nails done, or I'm going to have date night with my husband, or I'm going to go and spend the weekend with my mum, or do something nice with my kids. And you just get really good at managing it. And I think one of the key skills I've noticed a lot with all of my colleagues, whether in whatever field they're in healthcare, is that we're all exceptionally organized. And you have to be organized, and you have to learn to manage your time. And people often will say things like, oh my god, you're superwoman, you're this, you're that. We all have the same 24 hours in a day. I'm not doing anything that you can't do. I just manage my time better. And it's a skill you have to learn. So it means that I factor stuff in. So, you know, this meeting, for example, has been factored into my schedule for weeks, and I know I'm doing it. So I've then figured the rest of the day out according to this. And you just get really good at it the older you get, I promise you. And it's nice, you know, to be able to factor stuff in and also have your spontaneous moment. It doesn't mean I don't have spontaneity. If I have an evening free, it's always great to be like, oh, let's go do something and find something to do.
Even if it's just going for a drive and getting an ice cream with a friend.
Yeah,
It's
absolutely.
fun. It's fun. Just go through drive through McDonald's, like whatever. You'll also find that you make some of your best friends at university, and they will know what you're going through because they're doing the same degree as you most of the time. You will find that they all have similar schedules or different schedules, but you'll make it work. And like I said earlier, if you enjoy what you do, it will not feel like a chore. I love my equals. You are the only pharmacist covering the whole of the hospital for that night. But I love it because I feel like that's when I learn the most. That's when I have the most opportunity to expand, develop, think, and it's great. It really just depends on what you will enjoy, and you will learn that as you go along. You'll learn how to manage your time as you go along. I think I'm still very much in the phase of trying to find time for everyone, but it's not realistic. And with time, I think we'll get that.
And time management and commitments, what other challenges do you think, what other challenges does a role bring, and how do you kind of manage those, and what's been like the biggest challenge you've faced in the role so far since you've been in the hospital setting?
I think you have to remember that, you know, like I said, it's lifelong learning. So there are certain times in our year where we have to submit like portfolio evidence that we are meeting certain requirements, that we are doing audits. So there's a lot of work outside of your job. So although I work a 60 to 80-hour week, I also do other stuff on the side. I'm constantly updating my knowledge. I'm constantly reading guidelines. And then when I had to do my exams, and I've now achieved like my MRCPCH, which is my membership to the Royal College of Pediatrics and Child Health, which says I have a knowledge standard that is, you know, fine. And you know, it's not easy doing exams. Like, these exams are crazy expensive, and they require a lot of study. And it's not like at uni where you've got the whole day to study. You are working, so you come home and you have to find time, and you do just find time. You have to be really meticulous about, I don't know if you've heard of the Pareto principle, the 80-20 rule.
Yeah.
And it's something I swear by. So if all of you that are reading, if you don't know what the Pareto principle is, you really do need to like look it up, because if you're thinking about a career in healthcare and medicine, it's something that I swear by, and it's knowing where to concentrate your efforts and where not to. And that's the 80-20 rule. And it gets easier with time.
I'd say the key thing is that healthcare is not the only area where you're constantly learning and developing. So, for example, if you decide to take the accountancy route, you've got chartered accountancy exams you have to do, which you will be working and learning alongside. It's something that's inevitable in the future, generally, that you will have to update learning or do future qualifications. It's not impossible. If the generations above us can do it, why can't we? That's the way I think about it. And we can make it work, and we can enjoy it. And struggling, you asked what was the hardest thing we've been through. I think for me, it was doing my pre-registration year at Royal Brompton Hospital, so working for the first time, studying at the same time, and I had just got married a week before that. So just adjusting to that whole process. And I think the key thing is having supportive people around you, those who are understanding, letting work know of your home commitments as well, just having that open conversation, I think that's key. And that's how you can overcome those things, and just managing your time effectively, being organized, and just starting early. Like, for example, I'd have friends that maybe started revising a couple of months before. I may just start a little bit earlier to give myself that little bit more time.
Perfect. Sounds like you guys have some very busy lives, but you're doing really well and like kind of balancing and juggling everything. So thank you for sharing your nuggets of wisdom, inspiration, and I guess nuggets of wisdom and inspiration. Let's stick with that. So before we're going to wrap up, we're going to just ask you a few questions about tips and tricks for applications, and again kind of touch upon you know, taking gap years, and that I know you've already mentioned that it's okay to take gap years, especially with the whole corona stuff that's happening this year. Unfortunately, a lot of students have missed the marks, and those who have who wanted to go into the healthcare industry, many have kind of lost out their spaces this year, unfortunately. But what are the kind of key things that you like relate now that kind of in the healthcare sector? What are the couple of things that you might want to share with them, and what are the tricks and tips for applications and placements, and knowing like making sure that they're kind of having and taking an informed decision as to whether this is like the right path that they should take for their career route?
Okay, is it okay if I go first, because I have to run away? I'm really sorry. So if you're thinking about a career in medicine or dentistry, I think the first thing you need to do is speak to real people. So have a conversation with any doctors or dentists you know, and ask the questions that matter, how they manage their time, what their working schedule looks like, so you have an idea of what the next 10 years of your life is going to look like. The second thing is, if you are applying to UCAS, or if you're applying and writing your personal statements, find actual dentists and doctors to read them, because we are the ones that sit on panels. And it's great because sometimes like your teachers will read them, and that's fantastic, but then we see so many of them, and you can just tell people that have asked someone else to write it, or it's not true to who they are, or they've sat there with a thesaurus and just made a mishmash of it. Okay, so get someone to read your personal statement. Also, find hobbies to do. And people often think that this means they have to work in a GP practice, or in a hospital, or in a healthcare industry, or whatever. With COVID, this has drastically changed. So I don't know any GP practices, I don't know any hospitals, I don't know any dentistry currently, or even pharmacies that are taking students, because we've had to say no. So you need to get creative about how you're going to get work experience, and it doesn't need to be in a healthcare setting like that. You know, for example, I had a fantastic mentee who has never stepped foot in a hospital, is now currently studying medicine at UCL in her second year, and she worked at a homeless shelter for about a year. That has nothing to do with medicine and whatever, but what she gained was skills in communication, was skills in empathy, was skills in time management, was skills in appreciating how the law affects the common people, and how the law in the last 10 years has changed the face of poverty in England. And these were all great skills she had no idea she had until we started writing that personal statement. And you know, on top of this, she was also she was tutoring, and she was doing other things. So it's about showing that you are a well-rounded person, because that's what people want. You know, the best doctors aren't necessarily the ones that have the best grades. It's about those that have a holistic view about their environment. So make sure you have other things going on. And you know what, if you are taking a year out, don't be disheartened. I took a year out after I didn't get my A levels the first time round. I took a year out, reapplied, got an unconditional offer. There are other routes into medicine. You can do other degrees, you can do it abroad. Honestly, there is a wealth of opportunity. Don't be disheartened. Taking a gap year is fantastic. It grows you as a person. And if any of you want any help, I'm always very keen, and I am happy to be contacted. So my social media is on my bio, or on Instagram. Just reach out to doctors or dentists or pharmacists, whoever it is that you're applying to and you need some support with, we're usually more than happy to help. I'm going to run away, guys. Thank you for having me, and I'm sorry.
Thank you for being us. We really appreciate
Take care.
it.
Assalamu alaikum.
Take care. Inshallah.
Okay.
All on you, Subahi.
I would say I agree with a lot of the advice given just then. Not to be disheartened. I agree that work experience can be more difficult than it was before getting it. Be creative with how you can go about that. There's lots of online courses that you can do. I was a first aider for 8 years with St. John Ambulance. I feel like that made a big difference, more than my pharmacy work experience, on how I went about my application, getting a first aid qualification, Duke of Edinburgh, whatever it may be. Don't treat it like a tick box exercise, because on your application, it looks like a tick box exercise. Think about what skills you're actually getting from it, what you're obtaining, what you're learning, and demonstrate that in your personal statement. That's what people want to know. They want to know, how has that experience made you who you are now, rather than, I've done this experience, I've done that job. Does that make sense? As well as that, your subjects, whichever subject you may be doing. I did biology, chemistry, and history. For pharmacy, you have to have chemistry. I try to show how each one of those made me interested in pharmacy. History, a little bit of it's a bit different, obviously, to the other sciences. However, I talked about how having that understanding of essay writing and developing an understanding of what the past is will develop the future. That totally applies to medicines as well. Understanding the journey of a medicine, from start to finish through the clinical trials, how it failed, how it succeeded. It's all really important. So if you've got a car, I'm just thinking top of my head now, maybe consider doing deliveries for a pharmacy, community pharmacy, just trying to think out the box. I think it's very difficult to get into hospitals right now, understandable, because they're trying to make as much social distancing as possible, but just keep thinking of ways that you can still do experience. I would definitely look into online courses and ask your school, get your teacher's advice. Don't be afraid of sitting another exam or 2 or 3. It doesn't matter. Gap year can be the most amazing experience. And again, just like Corinne said, I'm more than happy to be contacted if you need any advice.
I think you mentioned a lot of brilliant points there, and I wish we could carry on and unpick all of them one by one. But we're really short for time. We only got a few minutes to Maghrib time, so I think we will have to wrap it up over here. So Jazakallah khair for being here. Really appreciate you and the doctor taking your time out. And I know personally I've benefited a lot. I'm sure the viewers have also benefited. For those of you that are new to the show, make sure to subscribe and follow us on Faith Inspire 16 on all of our social media platforms. That's Facebook, Instagram, YouTube, and Twitter, I'm guessing. I don't know. We will be having this is part of a new scheme we're trying called Let's Talk Careers, where we're going through different healthcare different professionals. This one starting off in healthcare, we'll be looking into law, business, engineering, accounting, whatever it is you guys want to hear about. Feel free to let us know in the comment section below, and we'll try our best to get that done. With that having been said, Jazakallah khair to everyone for tuning in. We look forward to seeing you all again soon. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam.